In this video, we are counting down the 10 silent warning signs of heart disease that most seniors miss and explaining exactly why knowing them could literally save your life. Did you know heart disease is the #1 cause of death for seniors? 40% don't make it because the symptoms are so sneaky. You chalk them up to just getting older. But here's the unfortunate truth. 1 in 4 heart attacks strike without a single warning. Think about that. You feel fine, maybe a little winded on the stairs, maybe a little twinge in your chest, and boom. Your heart's been sending an SOS you didn't recognize. Wait just a few hours too long and your risk of serious heart damage spikes by 30%. But here's the good news. Most of these deaths are preventable. If you know the early signs, you can cut your risk by more than half. And that's what this video is all about. All right, let's kick this off with a surprising warning sign. It may sound harmless, but for many seniors, it's actually a sign of real trouble.
Number 10. Digestive discomfort. It's not uncommon for seniors to experience digestive discomfort like nausea, indigestion, or stomach pain. However, when these symptoms occur without an obvious cause, they may indicate heart issues. Studies have shown that digestive symptoms, such as nausea and indigestion, can stem from the heart's inability to pump blood effectively. When the heart fails to circulate blood properly, fluid can build up in the abdominal area, causing bloating, discomfort, and digestive issues. A study published in Heart Failure Reviews in 2018 found that nearly 20% of seniors with heart failure reported digestive discomfort before being diagnosed. If these symptoms persist, it's crucial not to ignore them. They may also be associated with fluid buildup in the body as a result of heart failure. While it can feel like a simple upset stomach, unexplained digestive discomfort in seniors should be taken seriously. If you experience recurrent digestive issues that don't correlate with eating habits, it's important to see your doctor. Early detection of heart problems can greatly reduce the risk of more severe complications later on. Now that we've discussed digestive symptoms, let's move to another serious sign. Number 9. Cold sweats. Cold sweats are often associated with physical stress, but when they appear unexpectedly, they may be a warning sign of a heart problem. A 2019 study in The Lancet revealed that about 30% of heart attack victims experience cold sweats as an early symptom. When the heart is under stress, it triggers the body's stress response, causing a sudden release of sweat. This can be a sign that the heart is struggling to function. Cold sweats, particularly when they are combined with chest discomfort or shortness of breath, should never be ignored. If you suddenly feel drenched in sweat, especially without exertion or heat, and it's accompanied by other signs like chest pain, dizziness, or fatigue, seek immediate medical help. Delaying treatment can lead to serious heart damage. It's important to be vigilant about this symptom because it can be an early indicator of a heart attack or other heart-related complications. Now, let's explore another warning sign. Number 8. Persistent cough or wheezing. A persistent cough or wheezing that doesn't seem to go away can often be linked to heart disease, particularly heart failure. When the heart is not pumping blood effectively, fluid begins to accumulate in the lungs, leading to difficulty breathing, coughing, and wheezing. According to a 2017 study in European Heart Journal, seniors with heart failure commonly experience a persistent cough, particularly when fluid builds up in their lungs. This cough might produce white or pink mucus and may be confused with a respiratory infection, but it's actually a sign that the heart isn't functioning properly. In some cases, seniors might not notice this symptom until it has progressed, but it's important to get it checked. Persistent coughing, especially when accompanied by shortness of breath or swelling in the legs, may indicate fluid retention caused by heart failure. If you notice these symptoms, seek medical attention to prevent the condition from worsening. Now that we've discussed respiratory symptoms, let's move on to another concerning sign. Number 7. Pain in arms, neck, jaw, or back. Heart disease doesn't always manifest as chest pain. In fact, heart pain can radiate to other areas of the body, including the arms, neck, jaw, and back. This is a common symptom of a heart attack or angina, a condition that causes chest pain due to restricted blood flow. According to a study published in Circulation in 2015, nearly 40% of heart attack patients experienced pain radiating to other parts of the body before they recognized it as heart-related. This referred pain can feel like a dull ache, pressure, or tightness and may be mistaken for muscle pain. It's important to understand that heart pain can appear in unexpected areas, especially in seniors. If you feel pain in your left arm, neck, jaw, or back, and it's accompanied by shortness of breath or dizziness, don't hesitate to get medical help. Recognizing this symptom early can prevent further complications and help you seek timely treatment. Let's now shift to another important symptom. Number 6. Dizziness or lightheadedness. Dizziness or lightheadedness is a symptom many seniors experience, but it can also signal a serious heart problem. When the heart isn't pumping blood effectively, blood pressure can drop, leading to a lack of blood flow to the brain. This can cause feelings of dizziness, lightheadedness, or even fainting. A 2018 study published in Circulation found that seniors with heart conditions were at a much higher risk of experiencing dizziness due to low blood pressure or poor circulation. If dizziness occurs when standing up during physical activity or even at rest, it's a sign that your heart may not be pumping blood efficiently. You should take these symptoms seriously, especially if they are frequent or accompanied by chest pain, nausea, or fatigue. When you experience dizziness, it's important to monitor it carefully and consult with your doctor. Managing heart conditions early can significantly improve your quality of life and prevent severe complications. Now let's transition to another alarming symptom. Number 5. Irregular heartbeat, palpitations. An irregular heartbeat, also known as palpitations, can be a sign of serious heart disease. Palpitations occur when the heart beats too quickly, too slowly, or irregularly. This can happen when the heart's electrical system malfunctions, which can lead to arrhythmia or atrial fibrillation. According to a 2017 study in Heart Rhythm Journal, seniors with AFib are at a significantly higher risk of stroke and heart failure. When the heart doesn't beat normally, it can cause blood clots to form in the heart, increasing the risk of a stroke. Palpitations may feel like your heart is fluttering, skipping a beat, or racing unexpectedly. If you experience this frequently, or if it's accompanied by dizziness, shortness of breath, or chest pain, it's important to get checked out by a healthcare professional. Early diagnosis and treatment can prevent complications such as stroke or heart failure. Let's now explore another important sign. Number 4. Swelling in legs, ankles, or feet. Swelling in the legs, ankles, or feet is a common sign of heart failure. When the heart can't pump blood effectively, it causes fluid to back up in the lower extremities, leading to swelling, edema. A 2018 study in the American Journal of Cardiology found that 40% of seniors with heart failure experienced noticeable swelling in their legs or feet. This can be due to poor circulation and the heart's inability to maintain adequate blood flow, causing fluid retention. If you notice swelling in your lower limbs, especially if it doesn't go away with rest or elevating your legs, it could be a sign that your heart is struggling. This type of swelling is often painless, but can cause discomfort and limit mobility. It's important to seek medical attention if swelling persists or worsens, as it may require treatment to manage fluid buildup and improve heart function. Now that we've covered swelling, let's talk about another important sign. Number 3. Unexplained fatigue. Unexplained fatigue is a common yet often overlooked sign of heart disease. It occurs when the heart isn't pumping blood effectively, depriving the body of oxygen and nutrients. According to a study published in the Journal of Cardiac Failure, nearly 30% of seniors with heart failure reported excessive fatigue as an early symptom. Fatigue can happen even after a full night's sleep, and it can make even simple tasks feel exhausting. If you're experiencing extreme tiredness without a clear cause, or if your energy levels are declining despite regular rest, it's important to take it seriously. Fatigue in seniors, particularly those with a history of heart disease, can be a signal that the heart is struggling to meet the body's demands. It's crucial to consult a doctor if this symptom persists. Treating the underlying heart condition can help manage the fatigue and improve quality of life. Let's now transition to another concerning symptom. Number 2. Shortness of breath. Shortness of breath, especially during light activity or at rest, is one of the most common early signs of heart disease. When the heart struggles to pump blood effectively, fluid can back up into the lungs, making it difficult to breathe. A 2017 study in JAMA Cardiology found that shortness of breath was one of the first symptoms reported by seniors with heart failure. The sensation of not being able to catch your breath, even when sitting still, is a serious warning sign. It can also occur at night, waking you up from sleep due to fluid buildup in the lungs. If you find yourself becoming winded easily, even during tasks that you once performed easily, it's time to seek medical attention. Shortness of breath can indicate a number of heart-related issues, including heart failure, arrhythmia, or coronary artery disease. Early diagnosis and treatment are essential to improving heart function and reducing symptoms. Let's now discuss the most urgent and potentially life-threatening sign. Number 1. Chest discomfort. Chest discomfort is the most recognized and dangerous symptom of heart disease. It can feel like pressure, tightness, or mild pain that comes and goes. It's important to note that chest pain doesn't always appear as dramatic or severe as depicted in movies. According to a 2020 study published in Circulation, nearly 65% of heart attack patients reported chest discomfort as one of their first symptoms. This discomfort can be triggered by physical exertion or emotional stress and may feel like mild pressure, a dull ache, or a squeezing sensation. If this discomfort is accompanied by other symptoms like shortness of breath, nausea, dizziness, or cold sweats, it's crucial to seek immediate medical help. Ignoring chest discomfort could lead to severe heart damage or even a heart attack. Early treatment can improve outcomes and prevent irreversible damage to the heart muscle. If you experience any of the symptoms listed above, it's essential not to wait or ignore them. Many heart-related issues develop slowly, and early detection can significantly improve your chances of recovery. Here's a detailed guide on how to respond. Number 1. Don't ignore or dismiss them. One of the most critical steps in recognizing heart disease is not brushing off even mild or occasional symptoms. Seniors often dismiss symptoms like slight chest discomfort, shortness of breath, or occasional dizziness as part of the aging process. However, these symptoms could be warning signs that something more serious is going on. Even if the symptoms seem mild or go away after a short period, they can still indicate underlying heart problems. Don't assume they're just a result of aging or stress. Consult your healthcare provider if you notice anything unusual. Ignoring or dismissing these signs can allow a serious heart condition to worsen without intervention. The sooner you recognize that something might be wrong, the sooner you can take action to prevent severe damage. Number 2. Track and write down symptoms. Tracking your symptoms is one of the best ways to help your doctor understand what's happening and make an accurate diagnosis. Write down when you experience symptoms, how long they last, and what you were doing when they occurred. This can provide valuable insight into the nature of the problem. For example, if you experience chest discomfort, note whether it occurs after physical exertion, stress, or when you're at rest. Keep track of whether the pain is consistent or comes and goes. Also, write down any accompanying symptoms, such as dizziness, shortness of breath, or nausea, as they can help pinpoint the cause. By documenting your symptoms, you provide your healthcare provider with a clearer picture of what's happening and help them determine the most appropriate course of action. Consistent tracking can also alert you to any patterns that may not be immediately obvious, further assisting in diagnosis. Number 3. Seek immediate help for severe symptoms. If you experience severe symptoms such as intense chest pain, shortness of breath, dizziness, or fainting, don't wait to seek help. These are emergency signs that require immediate medical attention. Chest pain or tightness, particularly if accompanied by shortness of breath, nausea, or dizziness, could be a sign of a heart attack. If you experience any of these symptoms, call 911 immediately. Time is of the essence when it comes to heart disease, and the quicker you get help, the better the chances are for successful treatment. Don't hesitate or try to tough it out. Immediate intervention can save your life. If you feel like you might pass out, it's essential to stop what you're doing, sit or lie down in a safe space, and call for help. Never second-guess yourself when it comes to severe symptoms. Taking action quickly can prevent further complications. Number 4. Adopt heart-healthy habits immediately. One of the most powerful things you can do to improve your heart health is to adopt heart-healthy habits right away. Begin by cutting back on excess salt and sugar in your diet. Reducing salt helps manage blood pressure, while cutting sugar can help prevent obesity, which is a significant risk factor for heart disease. Additionally, focus on eating more heart-healthy foods such as fruits, vegetables, whole grains, and lean proteins. Staying active, even with low-impact activities like walking, can improve circulation, strengthen your heart, and reduce the risk of heart disease. Aim for at least 30 minutes of moderate activity most days of the week as tolerated.
So here's the bottom line. Heart disease doesn't always come with flashing lights and sirens. Most of the time it's sneaky. Fatigue, chest twinges, even stomach issues. Ignore them and you can roll the dice. Catch them early and you stack the odds in your favor. That's why it's on you to track your body, talk to your doctor, and start making moves that protect your heart. Think omega-3s from salmon or flax, a plateful of leafy greens, whole grains, and colorful fruits. And just as important, cut the junk, saturated fats, sugar bombs, and salt overload. What you put on your fork every day is either medicine or poison. If this video opened your eyes, hit like, subscribe, and drop us a comment. What's your go-to heart-healthy meal? We read every comment, and your idea might inspire someone else to make a change. Thanks for hanging out with us. Take care of your heart, and we'll see you soon on Senior Zone.